Assalamualaikum and good morning. Today, our group will be going to present about how Ministry of Health manage COVID-19. This is our group members, NURATHIRAH SOFIYA binti SYAHRUL AZHAR, HANI MAISARAH binti HASNI, IFARINA binti RAHIM, and NURUL SYAFIQAH binti RAMLEE.
Introduction. COVID-19, or known as coronavirus, is an infectious disease caused by the SARS-CoV-2 virus. COVID-19 discovered in December 2019 at Wuhan, China. This disease is very easy to spread and quickly all over the world. Symptoms such as mild respiratory disease, or some will experience severe pain such as prolonged fever, vomiting, or very severe diarrhea.
Every scholars have different perspective about the meaning of planning. According to Coles and O'Donnell, planning bridges the gap from where we want to go. It makes possible for things to occur while would not otherwise happen. But according to Henry Feniel, the plan of action is at one and the same time the result envisage the line of action to be followed, the stages to go through, and the methods to use. And according to L.F. Urwick, planning is fundamentally a mental predisposition to do things in an overly way, to think before and to act in the light of the fact rather than guess. According to Wikipedia, planning is the process of thinking regarding the activities required to achieve a desired goal. There are three importance of planning. First, planning reduces redundancy. Second, planning reduces uncertainty. And third, planning coordinates effort. There are several plans made by government in handling COVID-19. There are two types of plan, which is long-term plan and short-term plan. In long-term plan, only one family member allowed to go out, where at that time, the head of family will go out to buy stuff such as groceries. And the next one, certain types of shop are closed, where only hospital, clinics and grocery stores are open at that time. And lastly, MCO, which also known as Movement Control Order, for 2 weeks to handle the COVID-19 in Malaysia. Meanwhile, for short-term plan, there's social distancing, where we need to keep a distance for at least 2 meters from other people, and there's a tape at the store floor, so we know how much distance we need to keep from others. Next one is wearing a face mask, and last is always sanitize. We can see a lot of places started to provide hand sanitizer to make sure we are always clean from the virus. So, how did COVID-19 start in Malaysia? The COVID-19 started spreading in Malaysia when neighboring Singapore got positive COVID-19 from Wuhan, China. And how the government manage this COVID-19 from spreading is the government has enforced a Movement Control Order (MCO) starting on March 18, 2020 to break the chain of COVID-19. The people have also called it as lockdown. This Movement Control Order has encompassed restriction on movement, assembly and international travel. Since the border has been closed when the COVID-19 starts spreading widely, the government has also mandated the closure of business, industry, parliament and even school, where at that time we use online school and stay at home.
Organizing. What is the definition of organizing? Organizing is the process where the work is arranged and allocated to the organization members. Other than that, it is also a process that initiates implementation of plans by clarifying jobs, working relationships, and effectively deploying resources for attainment of identified and desired results or goals. Furthermore, organizing is the process of assembling the people, organize the resources, and distributing the planned work. Organizing is important because it increases productivity and goals achievement. This is because the employees share the workload. Other than that, organizing specifies the authorities. This will help the staff members know who they should refer to if they encounter some problem when they do their work. Lastly, organizing can encourage cooperation among organization members. In order to control the spread of coronavirus, Ministry of Health has introduced the Standard Operating Procedure of Movement Control Order, Conditional Movement Control Order, Enhanced Movement Control Order, and Recovery Movement Control Order. I'm going to explain only two of them, that is Movement Control Order and Enhanced Movement Control Order. SOP of MCO. During MCO, citizen wasn't allowed to cross state and district borders. So, Polis Diraja Malaysia, with the help from Angkatan Tentera Malaysia, Angkatan Pertahanan Awam Malaysia, and Jabatan Sukarelawan Malaysia, are the units that were responsible to monitor the borders. Other than that, during MCO, only 2% from each household were allowed to go outside to get food supplies, medicine, and basic necessity. They can only go outside within a radius not exceeding 10 km from their residence. They must also always wear a face mask, and social activities such as feast, birthday party, weddings, and tahlil was not allowed. Next, premise owner must ensure the customer were keeping their distance from each other at least 1 meter. They are also required to provide MAISARAH QR code and customer attendance registration book to help Ministry of Health monitor the citizen movement. Before customer come to the premise, they need to conduct a body temperature. Body temperature that are above 37.5 degrees Celsius are not allowed to enter. Next, the operating hours of restaurants, food stalls, roadside vendors, food courts, and other were reduced. They can only operate from 8 a.m. until 8 p.m. Dine-in is not allowed, and daily market and public markets are allowed to operate from 8 a.m. to 2 p.m. SOP of Enhanced Movement Control Order. During EMCO, PDRM is the one who is responsible for controlling the local area of infection with the help of ATM, APM, and RELA. The entry and exit road of the EMCO area were closed and was controlled by PDRM. Furthermore, residents were not allowed to leave their house, and only one person can go out to obtain the food supplies.
Okay, now it's my turn to present about decision making. Okay, what is decision making? Decision making is the process of making choices by identifying and selecting a course of action or alternative to solve a specific problem. In the effort of making decision, Ministry of Health need to clearly identify what is the problem and how to solve the problem. They should know the strength and weakness that they might face to make sure the decision was the best. In the making the decision, they need to collect some important information so that they know what to do. After that, they can list all the possible and desirable alternatives and choose the best one. Then, they can use the best decision or also can create a new procedure to solve this problem. Okay, decision making also has many important, one of which is being able to make better decision. This is because in making a decision, we will make a comparison between decisions that have been made by looking at the pros and cons of the decision to ensure that the final decision is the best decision. Next, by making better decision, we can use the resources provided well. For example, we can manage finances well if the workforce will work well with us. This can make work easier and solve problems. In addition, decision making also helps the organization to face problems easily and be able to solve the challenges that will be faced and be able to achieve the objectives that have been established quickly. It is because after identify and analyze various ways, then the best way will be chosen and implemented to help the organization. Okay, next one is final decision by Ministry of Health for managing COVID-19. Okay, the first one is implement the Movement Control Order MCO. The MCO is a control order that must be obeyed by all Malaysians and implemented comprehensively. No direct movement is allowed except for those who have obtained clearance, such as frontline workers who are helping the government and the Ministry of Health Malaysia in dealing with this COVID-19. Among the strategies implemented by the government to overcome COVID-19, government decided to implement MCO 1.0 throughout the country. The Prime Minister Tan Sri Muhyiddin Yassin said this order was made under the Prevention and Control of Infectious Diseases Act 1988 and the Police Act 1967. This was done to prevent a new outbreak of the epidemic, which is feared to infect more people. Therefore, the situation needs to be taken drastic action to improve the situation as soon as possible. Furthermore, there is a comprehensive ban on all Malaysian travel abroad and a ban on the entry for all tourists into the country. By doing so, the government can prevent the spread of this endemic and can prevent more citizens of this country from being affected with an epidemic that can take life. Okay, the second one is announce the SOP that must be followed by all citizens during the implementation of the MCO. Okay, for those who does not follow the SOP, they can be fined or jailed if you don't want to follow the SOP that has been set. And then, some of the SOP that we must do is people need to wear face masks and use hand sanitizer when outside the house. Also, we are told that we need to avoid the 3Cs, which is a crowded place, confined space, and close conversation. Also, we need to practice in the 3W, which are watch, wear, and warn. By doing this, we can prevent the spread of bacteria and virus from spreading in the house. Okay, after that, government also have launched a vaccination program on 26 February 2021. This is because government and Ministry of Health want to increase the people's immunity in an effort to break the chain of COVID-19. This vaccine has been done in phases and given have several types, among them the Pfizer vaccine and the Sinovac vaccine. This vaccination is very important not only to protect yourself but also to protect your loved one, family members, and people around you. Overall, the government has done a lot of best effort in dealing with COVID-19 with the help of the Ministry of Health, and they are willing to treat patients without complaint, even if they have to sacrifice time for their own family members.
I'm gonna explain about controlling. Definition of controlling. Controlling implies information combined with action. Controlling also measures the deviations of actual performance from the standard performance, discover the cause of such deviation, and take corrective actions. Controlling also ensures that organizational resource is utilized by effective and efficient so the planned goals achieved. There is a various opinion about controlling definitions by scholar. One of them is controlling is a systematic exercise which is called as a process of checking actual performance against standards or plans with a view to ensure adequate progress and also recording such experience as is gain a contribution to possible future needs by E.F.L. Bridge. The next one is controlling is the measuring and correcting of activity of subordinates to ensure that events conform to plans by Cons and O'Donnell. Lastly is control in its managerial sense can be defined as the presence in a business of that force which guides it to a predetermined objective by means of predetermined policy and decision by Dalton mc.farlangs. Importance of controlling. There is 5 importance of controlling. The first one is order and discipline. Second, boosting the morale of the employees. The third, achievement of goal. The fourth one, basis for the future action. And the fifth one, basis for execution of plans. Order and discipline is to decrease the unprofessional behavior of the representative and check the performance of the employees. Next, boosting the morale of the employee is to reward or give a promotion to motivate the representative to perform at their best level. And next one is achievement of goal, is to measure the execution of each possible arrange to find out the deviation to satisfying organizational objective. And the second last one is basis for future action, is to representative and division of the association is represented by a predetermined set of objectives to motivate worker in maintain a strategic distance from duplication of efforts. And the last one is basis for execution of plan. Work as a direct for everybody to arrange future exercise and to give set of standard education directors as well as subordinates work concurring the standard. The last part I'm going to explain of controlling is controlling strategy that done by Ministry of Health for managing COVID-19. The first one is quarantine of epidemic area and travel restriction. This means the Ministry of Health requires all travelers arriving from a country where there was a coronavirus outbreak to notify this fact to the authorities as soon as the first instance of coronavirus outbreak was detected. All travelers and students, even those without symptoms, were housed in lodgings, shelters, or educational institutions upon arrival. They underwent 14 days of scheduled intervals of serological testing for the virus. Employees who were thought to be infected were told to stay at home for at least 14 days and were granted sick time. Second, mask wearing and social distancing. Every activity such as social events, school, university, and others were prohibited and shut down because to prevent the people from any contact. And the third one is close contact tracking. There is an app that called MAISARAH, and all citizens must have or download MAISARAH application in their smartphone. This application is to help Ministry of Health to track down and controlling the outbreak of the virus. MAISARAH is an application to monitor and check for a close contact of individually with COVID-19 patients. Any individual who feels sick, positive COVID-19, or close contact with person who is positive with COVID-19 need to update their status in MAISARAH application so that Ministry of Health will alert of the symptoms and take the precautions of the place being reported for the cases. And lastly is COVID-19 vaccine campaign. There is 5 types of vaccine. The first one, Oxford, AstraZeneca, Pfizer, BioNTech, and Sinovac. These were the vaccines that were utilized. The Ministry of Health, medical experts, and social media influencers run numerous national efforts to increase awareness. Before the vaccination become required for all ages, it underwent a series of tests. Unvaccinated citizens will lose their government job and be prohibited from entering public spaces such as shopping mall, market, school, and any other place. That's all from me. Thank you.
In conclusion, Ministry of Health has been able to manage COVID-19 with a success because they have been using the 4 management process such as planning, organizing, decision making and controlling. These 4 management processes help Ministry of Health to achieve their goal easily. Their goals are to control the spread of the virus and to ensure the citizens are safe from the infection of COVID-19. That's all from us. Thank you.